Good afternoon and welcome to Effia Nkwanta Regional Hospital. My name is Dr. Joseph Campbell. I'm the medical director. Today is the occasion of our second open day ceremony, and as you can see behind me, we have a multitude of staff who are engaged in all sorts of activities, including medical screening, health education, testing, and free OPD consultations. We'll be having some staff entertainment and all that later on. Okay, so come with me on a little tour. I'll take you around some of the important departments within the hospital, and I will show you the site for the proposed Effia Nkwanta redevelopment project. So come with me. The main OPD waiting area, and as you can see, there are many people who are waiting to be seen. Even though the open day is going on, you have staff who are interacting with some of the patients who have come with us. So let's continue. Good afternoon. Hey, Charlie. Hey, Lawani. Good.
I have to come to your office.
You have to.
Bring you some food.
That's great. I love it. Yeah. Okay. So as the open day is ongoing, you have some of the big men in the hospital doing a tete-a-tete. You have Mr. Dasso, head of administration, Mr. Uso, our welfare chairman, and then our auditor. They are doing a tete-a-tete. Whatever they are planning or plotting, we don't know. Okay. So okay, so these are the famous 99 steps of Effia Nkwanta Hospital. These are 126 steps to the ward area. Where we are is the OPD. So as we're going towards the ward area, we'll climb these staircases. The staff call it the 99 steps. Let's go. Okay, so to my right is the ENT area, the existing ENT. ENT means ear, nose, and throat. Good. Okay, and to my right is the Mr. Tete. To my right is the diabetes hypertension clinic, and then after that is the OPD pharmacy. That's what you're looking at right now.
It's Body Beats the Drum King.
Okay, so to my right is the dental clinic. It's a heavy day for them, so to see staff and patients and visitors, lined up. They are doing free oral screening.
Good afternoon, sir. It's Kosovo Psychiatric Hospital in Psychiatric Department.
This one, the back.
This one.
Yeah, the back of it. Okay. So let me show you a very important unit. Okay, so this is the newly established breast care clinic. Okay, this is where they do the screening detection, diagnosis of new breast cancer patients, and then they also do the chemotherapy, that is the administration of cancer medications for people who have been diagnosed. Good afternoon, everyone. Yeah, so
It's body
entrance, oh, apologies. Good afternoon. I go. So you're welcome to the breast cancer clinic. This place was put together by Roche, who are very instrumental in managing breast cancer in our country. We are grateful to them for helping us establish this. But we need a bigger place. As you can see, the place is quite small, so it will be difficult to have a large number of patients and staff working here. So we definitely need a bigger place. So this is a breast care center. And as I mentioned in my speech, they've done a lot of work. They are continuing to do a great job over the years. And I'm what to say.
It's body beats the drum key.
Also be dressed, yo. Okay. So we just finished climbing the 126 steps, and I'm out of breath. So it means that the stamina has gone down. Man needs to work harder. Okay, so Kwame, as we catch our breath, let me. Okay, can I go ahead? Okay, so let me introduce you to the project site. To my left, that's the northern aspect of the hospital, and then to the right is the southern aspect. Okay, now as you can see, the entire southern aspect has been cordoned off. Okay, it's been cordoned off using aluminum sheets. Those of you who know Effia Nkwanta very well, you can see down there, that sole building standing, that is a blood bank. The blood bank has evacuated from there, so it's going to cease to be the blood bank pretty soon. So you can see that to my right, all the buildings that used to exist. What we are looking at here is the space that used to house the orthopedic ward, or Ward D. That's been long gone. The place is now a ground zero. Demolition is complete. You can see work going on a new demolition. That is the CT scan unit. It's also going down. Now, beyond the CT scan unit is where we used to have the accident and emergency unit. Now, that accident and emergency unit is no longer there. Beyond the accident and emergency, we had where we call the female medical ward, or Ward A. That one too is gone. Now, down there where they parked these disused items is where we used to have the female medical ward. On top of it used to be the kids ward or pediatrics ward. That is no longer there. That is no longer there. Good. Now, if you look behind me, that's here. Now currently here is the reproductive and child health unit, RCH, and beyond it is the central pharmacy. These are going to be the last two units to be demolished. So the RCH, the antenatal clinic, and the central pharmacy, these are the last areas. Yeah.
So where will we get our food?
Your food will be brought to you.
It's body beats the drum key.
the laundry unit. The kitchen is upstairs and the laundry is downstairs. Okay. Now, the design of the new project is going to be such that there's going to be a multi-story building coming on this side, which will fit into the existing structures. So like I mentioned, the central pharmacy and the RCH will give way to this 6, 5 or 7 story building that will fit in to make it look like, a one compact building
So what will be the capacity, and in terms of change, what are we expecting?
Yeah, so the expectation is that we're going to have about 500 beds. We're going to have about 500 beds in total. We're going to maintain some of the beds we have here already and then add on about 300, 400 beds. So that's going to be some 500. And the exciting thing is that some of the cutting edge areas in medicine are going to be added on. So we're going to be having the top range of diagnostics, including CT scan, fluoroscopy, MRI, of the top range. We're going to have a new theater building that has 6 new theaters added to the 2 we have here already, and the 4 operating rooms we have. So that gives us a total of 10 operating theaters, plus an additional theater in the new accident and emergency center, and another theater in the obstetrics unit for emergency cesarean section. So in total, we're going to have 12 operating theaters. Okay. Now, aside all these, there's also the construction of a 40-bed infectious disease center at our current CDU. That's going to take all infectious disease cases. So if you have any outbreak of cholera, let's say COVID now is common with us, whatever, any infectious disease, those patients will be taken to that infectious disease unit and taken care of. Now, so what we are seeing here is the phase 1 of the project. Phase 2 is envisaged to tackle the OPD area. That's where we're coming from. It's going to tackle that area and convert the OPD and its adjunct structures into a polyclinic, which will be like a first point of call for the neighboring communities. And then the top part here is going to be the tertiary hospital, which is only going to be for referral cases. So that's the grand plan. I think eventually all this will be topped up with the construction of a medical university to aid with the teaching purposes. So we're hoping that Western Region will have its own medical university, which will be training all cadre of healthcare personnel, including doctors, nurses, laboratory, radiologists, and so on and so forth. So it looks like exciting times ahead for the healthcare in Western Region.
How long is it going to take for us to complete this particular project?
So the first phase that we're talking about is earmarked, is estimated to be completed in about 30 months. About 30 months, so that's about 2.5 years approximately. So commissioning of the project is hoped to happen somewhere in 2025. And mind you, it's not just the construction, it's also the equipping of the hospital, the furnishing, and the training of the users of the facility. So all this adds up to the scope of the project.
How much is it costing us?
That I don't know. Okay. That is beyond my my knowledge.
I see. All right, just go. There's a few basic questions about Effia Nkwanta. With regards to efficiency of services at Effia Nkwanta and all that, a lot of people do have perception that public hospital, we come here and then sometimes they don't treat us well.
Yeah.
Yes.
Okay. So
a whole lot. So.
Yes.
Let's see. What can you say?
Let's sit here and talk.
Okay.
Yes.